Here we are back again on the TermiGuard soapbox, today with a topic that I remember worrying about as a kid, ticks. I was the child who was always paranoid to go play in the woods because of ticks. I think it was because one time I was traumatized after seeing my dad lighting a match and putting it to his arm one day after being out in the yard raking leaves. So let's talk today about what ticks are, how they can bite and feed off hosts, how to take care of a bite, and what to do to prevent from getting bit. So lots of information in only a few minutes. Let's roll. Ticks are in the spider family. They have barbed mouthparts that allow them to latch on to a host and feed on the blood. These are not to be confused with other bloodsuckers such as bedbugs and mosquitoes, which are both insects. There are two types of ticks, hard and soft ticks. They have big names, but this is the layperson's version. The hard tick has a black shell and latches on to the host and can feed for several days and weeks at a time. It is not until the end of their feeding cycle that they become so engorged with blood that they fall off and could at that point potentially transmit diseases onto the host. A soft tick does not have a hard black shell, and they only feed for a few hours, but can transmit disease within minutes. These ticks are more commonly associated with pain at the time of bite, but generally, hosts do not feel when most ticks bite. The reason for this is because ticks have the ability to inject neurotoxins into the host through its saliva, which acts as a pain reliever or a muscle relaxer. It causes paralysis to the area so the host cannot feel the mouthparts when lodged. The saliva also has the ability to thin the blood to make feeding easier. Who let these guys into medical school? Generally, if the ticks are found and removed right away, there won't be any reaction by the host. But most hosts do not feel the bite, and the longer the tick is latched on, the greater the chance for disease transmission. Oftentimes, symptoms don't occur for weeks after the tick is removed or unlatches. Blood work can't even detect Lyme disease and Rocky Mountain fever until weeks after the bite occurs. Many people are bitten by ticks and have no health reactions, but for some, the reactions can range from mild to very serious and may need medical attention or hospitalization. Symptoms to look out for are fever, muscle or joint pain or paralysis, fatigue, confusion, or flu-like symptoms. If these occur, you should consult your physician. But that's enough for illnesses and diseases, because the best thing to do is be educated and vigilant on where ticks are and how to prevent yourself from becoming their host. Ticks like to hide in low brush or woody areas. Pay attention when you lean up against a bush or a tree, and avoid sitting against stumps or logs. Sitting on a towel or a blanket when on the grass or going to the hay rides this fall will prevent ticks from biting. Make sure the towel protects the back of your legs as well, or wear long pants and boots. If you're outside in an area where you may have been exposed to ticks, check your scalp and have a family member help you check your body for ticks. But life happens, so what do you do if you're bitten by a tick? Some of Granny's methods for tick removal are not exactly the best courses of action to take. Common myths include burning the tick or painting over it with nail lacquer. Both of these methods could cause more harm to the host, so let's try something else. Many people know that the tick's head is the problem area. It's where the mouth and the head are attached and where the potential for disease transmission takes place. For both these reasons, it's important that you know how to properly remove a tick so you do not mistakenly leave the head and teeth lodged in the host and actually increase the potential for disease transmission. You want to use a curved-ended tweezer to carefully flip the tick onto its back and gently peel the tick off, staying as close to the skin as possible. If the head or the teeth remain in the skin, they need to be removed by a doctor. After the tick is successfully removed, apply antiseptic cream to protect against infection. But take note, this will not affect the chances of disease transmission, so pay attention to the bite for several days after removing the tick. If any symptoms occur, consult a physician. Applying insecticide can help treat areas prone to ticks in order to protect your family and pets as we enjoy this last bit of nice weather before winter arrives. If you need assistance, call TermiGuard and we will explain our lawn power spray service that helps reduce the number of ticks in your yard. Well, that wraps it up for today's episode. This is Christina. Thank you for joining us back here today on the TermiGuard Soapbox. Have a great rest of your day.